So I'm Michaela. I'm a core team member of Video Lab, and I'm very much involved in the community around it. So we're here joined today with Jamiu Busari. I'm really sorry if I completely mispronounced your name, actually.
Yeah, well, I mean, it's okay. I don't think you mispronounced it. I'll say Jamiu Busari, which is yeah, Jamiu. It's just where you place the emphasis.
Okay, Jamiu, thank you. I've been going over it in my head the whole time, and I was like, oh, I'm gonna mispronounce it. Well, um, so I've seen you participate in many different prestigious organizations, some as a associate professor, I believe, of Maastricht University, a former executive member of MVMO, an honorary fellow of the Royal College of Physicians and Surgeons of Canada, and many more, I'm sure. So I guess my first question would be, what would you say your overarching mission and goals are with your activities in daily practice?
So I've been asked so many questions, but this is, let me say, this is the toughest one, the toughest one in a sense, like a comprehensive, a question that requires a comprehensive answer. My overall mission is, simply put, making a difference. A reflection, having participated and achieved all the accolades academically and professionally. These have been the results of me trying to achieve or prove something, because for me to get through, I needed to prove that I was good enough. And essentially, when I describe myself, I see my professional and academic career through three pillars. One is as a scholar, researcher, scientist. And the other is like a clinician, which is also what I trained to be. And then the third is as a healthcare leadership. So those three things sort of exemplify who I am. And then what you then see is that, depending on which area of focus, if it has to do with my scholarly work in medical education, for example, then being a member of the executive board of the Dutch medical education board, for example, is a reflection of that. Now, if it's being an associate professor of medical education, is a reflection of that. If you look at my leadership activities, for example, then being a founding member of Sanocondu, or being a Canadian certified a physician executive, is a reflection of that. And if you want to look, if you look at my clinician role or as a doctor, then being an honorary fellow of the Royal College of Physicians and Surgeons of Canada is a reflection of that. Or being a clinician scientist at Ontario Tech University, for example, is also a reflection of that. So, I mean, this is probably a long answer to the question, but it gives you some background to the myriad of achievements, I would say, to put it, that I have put together over the years.
Definitely. And going into maybe looking to your research, I obviously was having quite a look at some of the papers, and I did notice that you cover a wide range of topics. What would you say your preferred areas of research are?
Yeah. So my preferred area of research at this present time and at this stage of my career is in the area of social justice.
Okay.
And then social justice within the field of those three areas: social justice in clinical work as a doctor, as a physician; social justice in medical education, which is why I'm going to AMEE, for example, and social justice in the area of leadership. For example, I am the commissioning editor at BMJ Leader. BMJ Leader is one of the subsidiary journals of BMJ. And Leader is all about leadership. And being a commissioning editor there gives me the opportunity to push for social justice when it comes to doing work in the area of leadership as it applies to healthcare, but also to leadership in general.
Brilliant. Yes, because I have seen obviously a little bit about what your talk is going to be about in AMEE. Could you give any insights into that, obviously without telling us your whole talk?
Yeah. Well, so I'm going to have a conversation, a dialogue with the attendees there. And I know one of the things, so one of the things that in preparing for this work is coming across the term syllogism. I don't know if you're familiar with that word, syllogism.
No.
But syllogism is it is a term that is used, and the best way I can do that is to use an example, because that is what we find ourselves, and it's made up of three propositions: a major, a minor, and one that ties things together. So a major proposition will be, for example, all Black people are lazy. Right? That's a major theme. So all. And then you say Jamiu is Black. That's a minor. And then I tie that together and say, because all Black people are lazy and Jamiu is Black, so Jamiu is lazy. All right? That's a negative. You can say all white people are rich. Michaela is white. So Michaela is rich. Well, I'm assuming you're very rich, right?
I wish.
So the point is, my conversation is about syllogisms and how we take different assumptions and we make them reality. In our attempt to prove a point, in our attempt to win people over, in an attempt to gain whatever it is we want to gain in life, we use many of these sort of syllogisms. Some of these syllogisms make sense, some don't. But the point is, it's a pattern of conversations that we found in the interactions we encounter ourselves in nowadays, which has contributed to a state of a lack of compassion for each other, lack of respect, contributed to the inequalities and the inequities we're having to deal with on a day-to-day basis, and also emerging in some of the microaggressions and discriminations that we are seeing around us. So what I'm going to try to do is have a dialogue where, not a discussion, because if I'm having a discussion, I'm trying to prove a point. I don't want to prove any point. I want us to engage in a conversation to understand these processes, just like I use syllogism to illustrate, the challenges we're having to deal with. I'm not proving a point. I'm just using it to illustrate to you, and then hopefully you understand that if we are aware of how we engage in conversations with each other, we might think, well, if this is not yielding the results we want, maybe we should change the way we're engaging in conversations. So that is what actually, I hope what I'm saying makes sense to you, but that is what I'm going to achieve, trying to achieve that day. And I hope you're there to attend.
Definitely. Speaking of that quickly, what day is it actually that you are, that your talk is on?
It's the closing plenary. That's the last day of the conference.
100%. Yes, I'll definitely be there. No, it's not. I think it sounds so interesting, and it's very much on, obviously, people, as you've mentioned, judging people or grouping people together, without, as probably as you've mentioned, maybe subconsciously, maybe not meaning to. And I think it's a conversation that's necessary because it will make people reflect. And as you said, it's your aim is to have more of a conversation rather than a discussion or a presentation. It's just Yeah, it's very, very important. And I guess linked very much to that, then, um, what what has been probably the most significant milestones, would you say, in your medical career? I'm not sure if it is linked to your talk or to the subjects around the talk or not.
Oh, what's been the most significant milestone? That's a tough one. I have been it's a tough one. I've been privileged to have been recognized for so many things in my career. I have this most significant milestone. I think the most significant milestone for me. Um, okay, I don't think there
Or
will
the
be
most
more.
special one, the one that meant the most, maybe, if you have one.
Okay, well, so there is one and a half. Okay, I'll say one and a half. Why? So um um after my keynote at AMEE, then that will probably be the most significant milestone for me in my career. But as
Hmm.
of today, the most significant milestone for me in my career, among the many, is my honorary fellowship of the Royal College of in Canada.
Hmm.
Being awarded an honorary fellowship is like that is as a scholar being recognized. I mean, I'm not Canadian. I don't practice in Canadian. I'm international. I'm being honored and given an award is significant for me. But being able to speak on a podium like AMEE as in for an educationalist, that
Mm.
is because not all of us are going to get that opportunity to deliver a keynote at AMEE, right? So for me, that's one of those things that is very significant.
Definitely. I think both of them are brilliant achievements. And I thought this might be challenging because when I was having a look at, your different profiles and the different websites that I found, and I obviously found a couple of interviews as well, that you've done, and you speak about such a large and a wide range of organizations that you've been a part of yeah, just so many incredible I think achievements. And I think, especially within medical education, I think it's incredibly important.
Yeah, thank you so much.
Um,
I really appreciate that. Thank you so much. I mean, that's kind of you.
of course. And how would you say your field has changed since you first started practicing?
It has changed a lot.
Yeah, I can imagine.
We're now into the era of AI, so
Mm. Definitely.
you
Well,
know,
this
it,
is very much another question that I have. Like, with such a rapidly changing world, how do you see the roles of medical professionals changing, and how do you see everything evolving, especially with AI, I
yeah.
think.
So I'll tell you. So when I started medicine, I my first degree in medicine I obtained in Nigeria, which is my roots. So when I was born and raised in England, and my parents went back to Nigeria, I went with them. So my first degree, my MBCHB, was in Nigeria, and
Wow.
training there back then, computers,
Yeah.
forget it. It was like,
Yeah.
yeah. I mean, you had to, we would spend hours. So our lecturers will be dictating from their notes, and then we'll be writing those writing it down, and then that's what we're going to read and use to study for exams. And it was at that level when I wrote my first thesis that I wrote. First of all, I wrote it out, and then I went to this guy who had a typewriter, those old things,
Yeah.
and I'll spend hours dictating. I'll sit beside him, and he'll be writing out, typing it out for
Wow.
me. And if he couldn't read my handwriting, I had to spell it out for him. So that's how I wrote my very first thesis. Okay, so that was back then, and I'm
That's
talking about
incredible.
this like the early mid 80s. Okay, then fast forward to where we are right now. I mean, I saw the advent of computers. Those, first computer, and now I have a MacBook Pro 14 and all these M3 and M10 and whatever they're calling those things. And now we're talking about AI medicine, and that's a totally different level. And there has been a lot of change. Many have been very, very beneficial for us as practitioners, for us as learners, but also for us as recipients of care. But I've also seen the inherent dangers with the rapidity of all of the innovations, and it's going at a pace that I am truly concerned on how to manage it. If you see the rate at which the technology is changing and the way it's being used, but also being abused and misused. So there is concern. I wouldn't say scary at this point in time, but there is a lot of concern. Yeah.
I think it's that way with a lot of industries at the moment. Obviously, I think it's definitely a lot more serious within healthcare because you're talking about people's lives and their fitness and their well-being. It's not just possibly, a robot taking your job. It's actually people's well-being. I guess this is very much related then, but maybe trying to look at it in a different way, not so much within AI. Are there any advancements in medicine and technology that you're actually excited about and that you can see changing the practice of healthcare for the better in the future? Or any tools in particular that you see help your students or help your colleagues or yourself, obviously, as well?
Well, I mean, prior to I think robotics has been one of the, robotics in the area of minimal invasive procedures has been one of a significant. It has reduced the admission time. It has reduced rate of recovery. It has reduced the precision in terms of treatment. So those have really been, in terms of innovation, that's really been fantastic. So I'm excited about that. I must say, artificial intelligence also has been really, really fantastic in the sense that, we've artificial intelligence has been around for quite a while, but what we're talking about now is this is like level 3.0, 4.0 of artificial intelligence, because we've been using many of these automatic intelligence software programs in medicine, and at a very low level. I mean, just take for example the sensors that open the doors, or the when it's a form of artificial intelligence, isn't it? Picking up movement as we pass by, and so it again, at the end of the day, it all boils down to the responsible application of all of these technologies, which is where I am. I am an innovator and have been involved in all sorts of innovative ideas. But in this case, I'm going to be. I'll just be an early adopter and not an innovator. I'll wait for them to figure it out first before I jump on the train. So I'm not against it, but I really want it to have it established, and then see what are the merits and what are the dangers before I jump on board.
Yeah, I couldn't agree more. And I think it's very much you don't really have room within healthcare. You don't have room for trial and error. It has to, especially if it's, as you mentioned, the robotics that help with procedures, you don't have trial and error within those sorts of things. And I think you kind of knocked it on the head when you mentioned that it's how people use them. I think it's that people hopefully use them responsibly, that they won't be taken advantage of or used to cut corners in any way. Speaking of which, what are the challenges, do you think, for people getting into your field, and what advice could you give them to overcome the challenges when starting out?
Yeah. So what are the challenges? So that is a question that you cannot give a singular answer to, because again, as I've learned over the years, you have to take it into context. It's different for me as a person of color entering into a profession that has been designed on the premise of the white male, blonde, blue-eyed physician. Okay, as it will be difficult for a person who identifies as a white female entering into the same profession, not to mention someone like myself who identifies as male, heterosexual, black, of African ancestry, entering into that same profession. Now, so when I answer that question, what are the challenges? I can only give you the challenges as the way I experienced it as someone of color, which has actually been based on a position of disadvantage, a position where the premise has always been that you're not good enough, that you have to prove yourself, and you've had to, constantly show the world that you're good enough to be part or to enter into the program. Now, one thing I can say, I think that for you to succeed in anything at all, you have to work hard for it. You have to be, you have to put in the work. And what I do know is that you also have to be smart about it. You have to focus on the things that really make that difference, that contribute to it. If a hard work without consistency is not going to get you the result. Okay. So work hard and you're not consistent about it is not going to get you to where you want to go at the same time. So you need both. You need to work hard, you have to be consistent, you have to believe in, and you have to have a goal that you want to achieve. That, I think, for most people will help them make it in whatever profession, but especially in the field of medicine. You have to work hard, you have to be consistent at it. You have to exercise that muscle and stay focused. If you do that, then you actually get to the finish line, and that's about. And importantly, you have to have fun. You have to believe in what you want to do. You have to. Honestly, if you're doing something that doesn't inspire you, it's not going to work. So you can work hard, you can be consistent, but if whatever it is you're doing, if it doesn't inspire you, then if you get there, you're not going to be happy getting there because you just did it, but it's not going to be part of who you are. I tell people you have to do something that if they wake you up 1 o'clock or 2 o'clock in the morning, you'll jump and say, "Hey, let's go. What do I have to do next?"
That's a brilliant example.
Yeah.
Definitely. Okay, so just sort of wrapping up, our community is very much interested in obviously communication skills and soft skills training. How do you think that we could improve? I say we. I mean, how do you think healthcare and the practice of medicine can improve the way that these sorts of communication skills are taught to students? Or do you think there is any improvements that could be made?
So you might call me old school on this, but I think that I've written about simulation. I know about simulation, but there's nothing irreplaceable than the human touch, because at the end of the day, human beings are one of the most complex creatures on earth, and we all thrive on acknowledgement. We all thrive on kindness. We all thrive on compassion. We all like to be listened to. We all want to be treated with respect. So, for me, communication has to go back to the core, and that will be one of my messages in my presentation. Our shared humanity. I think one of the issues we have lost is our humanity. We've moved away from being our brothers or our sisters' keeper to focusing on what's in it for me. As long as it benefits me, I don't care about the person. We've moved on to, because it's not affecting me, it's not my problem, it's the other person's problem. But I think we have to move away from seeing it as the other person's problem, but make it our problem, because that other person's problem sooner or later is going to be our problem. So when we talk about communication, I think we have to come from a humble, humanistic, paradigm, and engaging conversations. When I'm having a conversation, make that person the center of the universe, for that give them all the attention to make them feel the most important person at that moment.
That's brilliant, and very powerful. What are your thoughts on the method of, as I mentioned, of recording interactions for practical training and for reflective practice? Do you have any thoughts? Have you, I don't know if you've ever actually done this before, or what do you think?
So, could you take that question again, please?
Sorry, I said, what are your thoughts on the method of recording interactions, whether that be obviously real patient consultations or like simulated consultations for training, for practical training and reflective self-reflection?
Yeah, so I support it, but there's there is an assumption we make, which I think is what would the right word to put it? Okay, so there is an assumption that that method works for everybody. We incorrectly assume that simulations and recordings are the way forward when it comes to communication skills development, for example. And I think that we have to leave that margin of exception, that it probably might not work for everybody. We tend to assume that everybody is the same, and that everybody has to go through these simulations or do these recordings, and if they do that well, And it's a conversation I'm having in a different area in terms of how we determine professionalism. Like, who's a professional and whose standards are we using to define professionalism? Just like education and communication, whose standards are we using to teach communication? And who says that way? I mean, there are communities where oral tradition and narrative storytelling are the ways of communication. And how do you learn that? You learn that there was a period in my life that I would sit, or me and my cousins and my siblings, and then my grandmom, she'll be telling us a story, and you'll be listening, and she could tell those stories, wow, and you say, wow, this is fantastic. But by listening and attending repeatedly, you learn how to communicate, how to tell stories. You understand what I'm saying? That's a different way of learning. It's not simulation, it's not recorded, but it's also a way of. So the point I'm trying to make here is for us to take into account the cultural context of how we define or determine whatever educational method we want to apply. Simulations, recorded teachings are from the West. They're from the Western approach. from in medical education. We use that as the standard in most situations. In AMEE, that would be the standard, one of the standards of learning how to teach communication. But what we tend to forget is that that is not the only way to teach, and that is just one of the probably golden standards, quote unquote, that you could use to teach communication.
Yeah. I think it goes back to your very, very important message and a very important point on to not generalize people, that every individual learns differently. Some succeed in some environments while others don't as well. They need some different methods. They need some different techniques. And yeah, that exactly as you said, that that to not generalize and not to put everyone in the same box.
Yeah, it just requires some humility. I'll say I would rather use the toolbox of analogy, that and there are various ways to teach communication. One of which is simulation, recorded teachings, but there are also other ways. And not just assume, as we most of the time do in most curricular designs, that the best way to teach communication is this. I mean, there are different methods that we just acknowledge that, and that is not that it can't be the standard, and also we have to be open to non-Western methods of teaching. Probably that's out of the scope of this conversation, but it's something we shouldn't undermine.
Definitely. Well, thank you so much. I think it's a good finishing point. And I appreciate so much for your time, and I look forward to your talk on next Wednesday. I'll definitely make sure that I'm there. And so thank you so much for your time. If you have any questions or anything that you'd like to say as well.
Yeah. So I mean, it's been a very pleasant conversation with you, Michaela, and looking forward to meeting you in person.
Yes.